What is it like being a Hispanic adult who is only Spanish speaking living in the United States seeking health care? The Hispanic population is the largest minority group in the United States at an estimated 52 million according to the U.S. Census Bureau. The Hispanic population is made up of about 60% Mexican descent and 40% Caribbean and Central or South American. Hispanics are among the least educated ethnic group residing here in the United States, and this can pose for many different problems and difficulties when Hispanics are ill or in need of health care. Language is one of the principal barriers Hispanics face in health care. The United States Department of Health and Human Services defines health literacy as the degree in which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Limited English proficiency, or LEP, means individuals are unable to communicate effectively in English because it's not their primary language. Since no two languages are the same, and there are many different dialects of each, translators can be extremely helpful. The translator has to ensure not only literal translation, but conceptual translation as well. Providing a trained medical interpreter for translation has shown to reduce medical errors, increase patients' perceptions of a welcoming health facility, as well as an overall increase in patient satisfaction. Underutilization of interpreters leads to more adverse outcomes for patients. Adverse outcomes include difficulties with informed consent, inadequate understanding of diagnosis or treatment plans, which then can lead to increased levels of dissatisfaction with the care provided. Federal laws require that healthcare organizations receiving federal funds provide interpretation services by bilingual staff or professional interpreters at no cost. There are written policies that are essential to help educate staff and ensure uniformity of services throughout the institutions. By providing the services, Hispanic patients may feel more comfortable seeking care when ill. Developing trusting relationships with patients is very necessary to help understand culture. Cultural differences help determine everything, including what we eat, what we wear, and where we go when we're ill. It is essential that nurses embody strong cultural competence skills grounded in evidence-based practice. Interpersonal relationships between patients and healthcare providers are essential for good healthcare outcomes. Cross-cultural education programs have been developed to enhance healthcare providers' awareness of how cultural and social factors influence healthcare. Better accommodation within healthcare safety is likely to increase in importance more throughout the next 10 to 15 years. According to a study done by the Western Journal of Nursing Research, interpersonal trust is essential to provide patient-centered care. These participants in this study noted, "You can immediately see when a person wants to help people, and even when a language barrier is noted, trust is possible due to the nurse's specific way of being." At baseline, Hispanics report the lowest satisfaction with provider communication, and due to this communication barrier, Spanish-speaking Hispanics feel that time spent with their healthcare providers are less than expected. Hispanic patients face greater challenges in seeking health care. By increasing cultural awareness and educating staff and healthcare providers more on the importance of bilingual education, we can bridge the gap and help Hispanics feel more in control and satisfied with their health care.